In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for Combating Coronavirus, COVID-19, His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace. And praise be to the Prophet. I'd like to welcome you today in order to inform you on the most recent updates regarding dealing with COVID-19. Allow me today, in these beautiful days, on the occasion of the National Day and the occasion of the accession of His Majesty to the throne, to extend our deepest congratulations to His Majesty the King and His Royal Highness the Crown Prince and Prime Minister, and to the people of Bahrain, our deepest congratulations, wishing you progress and prosperity. At the beginning, we highly appreciate the participation of His Royal Highness the Crown Prince by receiving the booster shot, and he is such a great example to take the booster dose and to emphasize the importance of taking this shot. And we extend our thanks to him by pushing us forward to take the booster shot, and for his support to the frontline health professionals. And as announced yesterday, as precautionary measures and in order to maintain the achievements of the kingdom, and after the review and approval of the executive committee, it has been announced that we are going to move to the yellow alert level. So, starting from Sunday, 19th of December 2021 to Monday, 31st January 2022. And we confirm that this move comes in line with the precautionary measures, although the Omicron is not spread in the Kingdom of Bahrain, thank God, but just in order to maintain the health and safety of the citizens and residents. As you know, we have achievements at the level of combating this COVID-19, so we need to maintain them, and that's why this is a precautionary measure. And in this light, we call upon everyone to follow all the precautionary measures according to the yellow level, and we invite all those eligible to immediately go to take the booster shot through the health centers without the need to take a prior appointment, and so that everyone should complete the shots and the booster shots according to the traffic light system. And according to this, all those who took the booster shot will take and practice their daily life. So, as we said, these measures are in line with our neighboring countries, and maybe in fact in Bahrain we had a bit less precautionary measures, but now it's at the same level as the neighboring countries. And to conclude, let's continue maintain the achievements and to implement all the precautionary measures and take the booster shots in order to achieve our desired goals. And before moving to Lieutenant Colonel Dr. Manaf Al-Qahtani, I also confirm again that we have been transparent with everyone, and we're still transparent. And when we're talking about the situation in the Kingdom of Bahrain, in terms of the spread of the virus or the number of people admitted to hospitals or to the ICU, the figures are really low, and this is good, and the recovery percentage is high. So we're still implementing the same strategy until we combat this virus. This is what I wanted to confirm. This is the strategy. We're going forward with it. And the second thing, by the way, we don't just predict figures. All the decisions that we take are based on data, research, studies that we conduct in the Kingdom of Bahrain. So now I'll leave the floor to my dear brother, Dr. Manaf Al-Qahtani. Please proceed. Thank you very much, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, good afternoon. We greet you. Welcome to this press conference. We're going to update you on the efforts of Bahrain's team. And first, let me inform you that since the beginning of the pandemic, Bahrain has been among the top countries who took the precautionary measures which maintained the lives of citizens and residents who are living in the beloved Kingdom of Bahrain. And the whole world is facing the attacks of the variants, but the efforts in the Kingdom of Bahrain are based on studies and that are local and global, which contributed to the decrease in the number of the active cases. And as mentioned by Dr. Walid Al-Mana, as a precautionary measure, it has been announced that Bahrain will move to the yellow alert level starting from 19th of December 2021 to 31st of January 2022. This is in accordance with the COVID-19 alert level traffic light system. As we know, we have local statistics and data, or whenever our task force found that it's important to change the color, so we take a precautionary measure. So this is part of this system. And we're in the Kingdom of Bahrain are moving forward to receive all the updates regarding the Omicron and all the studies we receive and look at. And that's why we moved to the yellow light system to study these research and learn further about it. So we decided to move to this yellow, and it will be subject to review upon further information. So we will assess the situation, the treatment protocol, and the regional context. And I would like to confirm that the national indicators have proven that the booster shot contributes to increasing the immunity in the body. And that's what we sensed since the last May. It helped a lot in decreasing the spread of the variants, including Delta. So the booster shot is part of the treatment protocol, and it is really important. And my message to whoever did not take it, please take the initiative and close this gap if all of you took the initial shots in addition to the booster shot. So I confirm that it enhances, as a booster shot, enhances the immunity and decreases the symptoms of the variants. And it's important that we continue implementing all the precautionary measures. Vaccination is one of the tools available to decrease the spread of the virus. So maybe some people would think that it's only the means. No, we have the precautionary measures, social distancing, wearing masks, washing hands regularly. All of these are tools that we shall continue implementing. And some of the countries, unfortunately, did not have the chance to take the vaccines. So for us, we're lucky, and that's why we have to follow them all. And before concluding, implementing the measures and our awareness will contribute to combat COVID-19, and we really appreciate these efforts, which are national and great, which have had their reputation everywhere. We have sensed the Bahraini spirit to achievement. So we shall all maintain these achievements in order to safely get out of this pandemic. Now, I'll leave the floor to Dr. Jamila Salman. Please proceed. Thank you very much, Dr. Manaf Al-Qahtani, in the name of God, most gracious, most merciful. We meet with you again in this press conference, and I'm going to talk about the updates of our team. At the beginning, let me refer that the National Medical Taskforce is putting the health of citizens and residents as a priority whenever they review the studies or the decisions. So what has been announced of moving to the yellow alert level was a precautionary measure in order to maintain all the achievements that were achieved previously. These results require us to move with the same determination by taking the shots, including the booster ones, especially while we're witnessing new variants. The second part is the vaccines for children. That's why we invite and we call upon all parents to arrange for their kids to take the booster shots, to take the vaccines as to maintain their health. It's important also to take the booster shots, and this is according to the local and global studies, which showed that these booster shots will decrease the symptoms and the severe symptoms and the complications. So the results are obvious. On the other hand, while taking the shots, it's important to continue implementing all the precautionary measures that we got used to in terms of social distancing, washing hands, wearing masks, because they are really important in decreasing the number of active cases. And to conclude, we wish you good health, and we confirm that committing to the booster shots and the vaccines will make the difference in making all the efforts success. Thank you. Thank you very much, the speakers. Now we'll take the questions from the journalists who are joining us remotely. Starting with Bana Rasha Al-Ibrahimi to Dr. Walid Al-Mana. What are the indicators through which you decided to take the yellow alert. And will this affect traveling and schools? Thank you. We have a clear message. Well, there are indicators that show that the Kingdom of Bahrain, thank God, the disease or the virus has been reduced. We had only a one limited ICU case. Also, the same thing with the death cases. We don't have death cases. So the indicators to assess the situation in the Kingdom of Bahrain, we don't have a problem. But if you remember that the task force could move from one color to another, not just based on the number of the cases, but sometimes we have occasions in the country or sometimes external factors. So today, Dr. Manaf and Dr. Jamila, if we're talking about the vaccines, some countries are not taking the vaccines or they have like new variants. All of these will lead us to take further precautionary measures. So the factors are not only in Bahrain locally, but also externally. As for travel, the travel procedures already have precautions. And we're having the same thing. We have upon the arrival test on the 5th day, on the 10th day. So just for people to know, the first day, God forbids, like there is an infection, we assess it within 24 hours and we analyze the variant as well. So we can detect the type of variant from the first test. The second test on the 5th day, if there are any contacts, we can check with them, those on the plane, those at the airport. We can check and test them on the 5th day, and rest assured that we have a big team who detect these contacts. And also the test on the 10th day. And so this strategy is what we implement. So now we announce the yellow alert. As a precautionary measure, Bahrain started with the booster shots as among the top countries, and we took all of these as precautionary measure. We have conducted tests with a large number of tests. So we are moving with this strategy, but just to let people, assured, we are doing our best, and just to rest assured. Our message, just allow me to say that vaccines, please, this is an opportunity for you. It's important. All those who did not take the booster shot, we want to maintain. And those who did not take the booster shot, please do. So His Royal Highness the Crown Prince, he was among those who took the initiatives. And even when doing the research, and he was among the top people to take the initiatives. So he is the example for us, and he is the leader doing this example to us. This is a very clear message to everyone, and nobody has any excuse. The health centers are open. You don't need to take an appointment. So please, everyone, take the booster shots today. And this is our message. A question to Dr. Manaf Al-Qahtani from Ashraf Al-Marzouk, Masters International Media. We've noticed that some manufacturing companies confirmed the efficacy of their shots, while some companies kept silent. So are there any decisions to limit the import of the medicines to those who announce the efficacy only? Thank you for the question. Thank you to Mr. Ashraf, and thank you to all the journalists whose questions are really important and reflect what has been announced or what is been asked in our community. So thank you very much, journalists, for asking such important questions. So my answer is we have two parts. First, we need to know that the efficacy of the vaccine depends from one vaccine to another. And in Bahrain, we have 4 vaccines, and it has given us an exceptional experience through which we have provided valuable information to the WHO. So the important elements of the vaccines is its safety and efficacy. And all of these 4 vaccines have proven this. Now, in terms of the efficacy, all these 4 vaccines vary in terms of the period. So it's not like they're not efficient, they are, but depends on the period of time. And the major part of these inactivated shots that they give you a great percentage of antibodies. So the efficacy by nature will vary from one vaccine to another, and especially with the presence of some variants like Delta, we have proven that these 4 vaccines were efficient, but some categories would need to take additional shots in order to reduce the disease. So all of them are efficient, but depending on the period of time. So it's important for people to know this. And by the way, Mr. Ashraf knew because we had a meeting, there was a meeting for the WHO which they tackled the same topic, the efficacy of the vaccines around the world, and not like, Pfizer or AstraZeneca. So the answer of the experts, then Anna Maria, who is the expert of the WHO, she answered, they said they contacted more than 300 research experts, especially with those in those countries with Omicron, to require further information, and those countries who have different types of vaccines like Sputnik, AstraZeneca. So they asked to collect all these information, and so far there is nothing to prove that, for example, certain vaccines failed to maintain the admission or prevented people from going into hospitals, but there are research being conducted, and the WHO will collect these information and analyze them, and we're going to hear the results from the specialized bodies. So I think, Mr. Ashraf, just to make it short, the 4 vaccines, they have efficacy, they are important, but the extent of efficiency will depending on the period of time for these vaccines. Thank you very much. Question from Budur al-Maliki, Al-Biladi newspaper, to Dr. Jamil al-Salman. What are the most common symptoms of Omicron, and will kids be infected with Omicron, and will they need a third booster shot? So you have 3 points here in the question. The first part, the symptoms of Omicron, they are the ones known to COVID-19. Among the cases of those in those countries with Omicron, that they are milder, they are not severe as the previous variants, but this is initial, because with a new variant we have to follow up at least like a month to know more about the ICU admissions, and we will know about this over the coming period of days. As for the main symptoms, they have the main ones are headache, the maybe throatic, tiredness in the body. Some countries, they said like lack of smell and taste or cough, and some countries they mentioned like they had they did not have it. So they vary as symptoms, but in general they were milder, and we're waiting for further information from those countries which had the spread of this Omicron. As for the second point, the kids being infected, they noticed in those countries that they were for less than 50 years old, but it does not mean like those over 50 will not get it. There are different factors. Usually they get those people who did not take the vaccines, and that's why those kids who did not take the vaccines, and also the elderly people who did not take the vaccines or did not get infected with the virus, and so they noticed that those group less than 50 years old, they had an increase, and with the kids as well. So to a large percent everyone, but mainly with less than 50 years old as a result of the vaccines and the degree of the spread of the virus. Now the third part, this question was asked many times: do they need a fourth shot? The initial studies collected and shared around the world, there is no recommendation to take a fourth shot, but we're in the Kingdom of Bahrain. We're studying the information we have with us. We analyze them. If those who took the 2 shots and the 3rd booster shot, is there a need for a 4th booster shot? Or do they need, and then the period? Is it like after the 4th? And we can answer this after we get the results of the studies we're going to share with you. Question Budur Al-Maliki, Al-Bilad newspaper, Dr. Walid Al-Mana. An Omicron case was detected coming from outside to Bahrain. And what is the status? And did it take a booster shot? And what is the scenario with the increase of Omicron around the world? And are there any new procedures? Thank you, Ms. Budur, for the question. Well, some of the information maybe she mentioned. It's important to know that there were precautionary measures taken as any other variant who enter Bahrain. But let me go back and say, this case was coming from outside Bahrain, and it was analyzed on the same day, and we took this appropriate action on the same day of the contacts on the 5th and 10th day. So the situation of the case, I don't have it with me now, but so we don't have the details of it, but it's important. What is the scenario, or what if there will be any changes in the procedures? As we mentioned, we have moved to the yellow alert level, and why we took this decision. But rest assured, everybody, that we don't have this Omicron spread in the Kingdom of Bahrain, and we don't have an increase up to today. There are no people admitted to hospital, and hopefully things are going to be all right for everyone. Thank you very much, the speakers, and also the journalists and reporters who sent us their questions. And for you, ladies and gentlemen, we extend to you our deepest congratulations on the national occasion, and kindly be reminded to follow all the precautionary measures to mitigate the spread of COVID-19. Thank you very much.